Good morning and a very warm welcome today morning at Panacea. And today we have sessions on yoga, endocrinology, and neurology as well. So we welcome Meher Munjal again, and we will have a very special session on meditations today. And she can brief us a bit about the session. And Meher, if you can kindly just brief us about the session today and go ahead with your class.
Thank you so much, Pooja. And I'm extremely glad to be back at Panacea. And I thank Panacea for giving me this wonderful opportunity once again to be able to do the yoga and meditation session for all of you today on this beautiful Sunday morning. And I thank Beatrice for giving me an opportunity to share the gift of yoga with all you beautiful people. So thank you again so much. And thank you, Pooja. So today we will be doing अगर आप हमारे साथ लाइक बने हुए हो तो आपको पता है कि हमने अभी अभी तक 3 to 4 सेशंस ऑलरेडी कर लिए हैं इन द होल मंथ ऑफ फेब्रुअरी एंड दैट इज ओनली योगा सो that we'll be only doing yoga practice, and we have done different styles of yoga like Ashtanga style, Vinyasa style, Hatha style, Vinyasa 2 style. So every day, every week, sorry, has been a different style of yoga. And in that we've learned how to start from scratch. We do the basic asanas, then we go into the pranayamas, we do the dhyana meditation, and then the next one little bit faster exercise movement of the body ashtanga, and then going to the vinyasa, which is a little bit more westernized, leading to the warrior asanas and everything. Just summarizing a little bit, as this is the last session of the month. uh, so as this is the last session of the month, we decided, Panacea and Yoga Connect, that is my company, Yoga Connect by Meher, decided to do the meditation session. And in the meditation session, we are going to do a talk a little bit. I will be talking a little bit about the meditation, what we are doing here today, why are we doing the meditation. But before we start the class today, I just want to request everybody to take 2 minutes or 1 minute and get a cushion. इस तरह से आपकी कोई भी कुशन होगी आपके घर में, या कोई पिलो या कुछ भी जिस पे आप बैठ सकते हो, तो या लेट सकते हो, तो प्लीज आप 30 सेकंड्स में देके आप ये कुशन ला सकते हो. तो प्लीज कोई भी आपके आप उठ के प्लीज जाके क्वेश्चन ले आइए और अपने मैट पे वापस बैठ जाइए और फिर हम स्टार्ट करेंगे. ओके, सो होपफुली आप सब क्वेश्चन ले आए हैं और सब बैठ गए हैं वापस मैट पे. तो अगर बिल्कुल भी क्वेश्चन नहीं है तो कोई भी चादर या कुछ आप ऐसे डबल फोल्ड करके आप ला सकते हो अपने पास. मेरे पास ऐसे दो दो क्वेश्चन है, 1 2. ओके, so without wasting any more time, I will start talking about the meditation. So for today's meditation, we are doing a meditation on letting go and on surrender. So nowadays, in this pandemic time, COVID times, we have experienced a lot of changes in our life that are not necessarily positive. A lot of changes are there for the negative as well. And we don't know how to cope up with it or how to keep up with it. So, for example, I think that this pandemic has taught us a lot about our own self, has brought us a little bit more closer to our own self. And just working on some issues that slowly, when you're staying alone or you're staying with your family, when you're staying with your own self more and more, you give time to yourself more and more, you sort of see those elements come out, you see those issues come out when you don't have option to go out and just walk away from your problems that most of us very normally do. um, we do face some challenges in our day-to-day life from our own self that come out. And today the session is all about addressing those challenges. So आज जो meditation है, it's going to be about letting go. Letting go ऐसी एक powerful technique है जो आपके mind, body और soul को बिल्कुल align कर लेती है, detoxify कर लेती है, purify कर लेती है और एक ही प्योरिफिकेशन की पॉजिटिविटी ले आती है. ठीक है. So what do we mean by letting go? Letting go is a process and a meditation. Today we are going to basically first talk a little bit about the issues that we're facing every day. After that, we will do some chant and pranayama. Pranayama we do every day to purify the body. After the pranayama, we will lie down into savasana. Savasana is when you just lie down on the mat with your feet little bit apart, your palms facing upward, and you close your eyes. मैं आपको एक बार दिखा दूंगी शवासन का पोस्चर कैसे करना है, बट मैं शवासन नहीं कर सकती क्योंकि मेरे को मेडिटेशन बोलना है. तो मैं बैठी रहूंगी, पर आप सब जो आज हमारी सेशन ज्वाइन कर रहे हैं मेरे साथ, वो सब लेट जाएंगे अपनी योगा मैट पर. एंड अगर आपकी बॉडी में कोई भी प्रॉब्लम या एक या पेन या जॉइंट इशू है या कुछ भी स्ट्रेस है, तो उस जगह पे आप ये कुशन रखेंगे. तो फॉर एग्जाम्पल आपके बैक पे इशू है, तो जब आप लेटेंगे तो ये जो आपकी कुशन है, जो पिलो है, ये आप अपनी बैक के नीचे रख के लेटेंगे. अगर आपके हेड या माइंड में कुछ स्ट्रेस है, तो फिर आप ये कुशन अपने हेड के नीचे रख के सोएंगे. सोएंगे नहीं, सॉरी, लेटेंगे. ठीक है. सो remember, जो cushion है, you put under the part of the body that needs healing while you're doing your meditation practice. Okay. So a couple of things that happened to us in this realization is often people, they want more and more. As human beings, we are greedy creatures and we want things more and more and more in our life. So what happens when we want something, when we are not getting? Supposing मैं एक कंपनी में काम कर रहा हूँ या कर रही हूँ, एंड मैं बहुत ज्यादा काम कर रही हूँ, बहुत अपना एफर्ट लगा रही हूँ 100%, और मेरे को एक पोजीशन चाहिए. मैं अभी इस पोजीशन पे हूँ, पर मेरे को हायर पोजीशन चाहिए. तो मैं इस पोजीशन पे हूँ, पर मैं बहुत ज्यादा काम कर रही हूँ, एंड मैं अपना मन लगा रही हूँ, मैं अपना टाइम दे रही हूँ, अपना एनर्जी दे रही हूँ, मैं अपनी फैमिली से थोड़ा डिस्टेंट हूँ क्योंकि मैं अपने वर्क पे पूरा हार्ट एंड सोल लगा रही हूँ, माइंड लगा रही हूँ. बट एट द एंड क्या हुआ, मेरे को वो पोजीशन जो हायर चाहिए थी, और हायर पोजीशन के साथ क्या आता है? एनी गेसेस गाइस? प्लीज कमेंट डाउन बिलो ऑन फेसबुक इफ यू आर वाचिंग. एनी गेसेस? हायर पोजीशन के साथ और क्या आता है? मनी, right? High position means money, right? So I am working very hard, and trying to reach that position. And what happened? Did I get that position? No. Somebody else got it, who's not working that hard, according to me, who's not giving that 100%, according to me. So what happened? I get greedy. I feel bad. I feel hurt. I feel my ego is hurt. Okay. And then what happened? I start going into negative zone. I start talking bad about company. I start talking bad about that person who got the higher position that I wanted. Okay. Then what happened? Then I start doing negative thing, going into alcohol, or slacking on my work, or taking it for granted, doing other things that are not good for my health, eating wrong things, drinking wrong things. And that goes into negative zone more and more and more, right? So this is something, a very common thing that happens, that animals, for example, don't have. They don't know what it is to have that greed. So they don't fight for it. They get little bit food. Yes, if they're hungry, they want more food. After that, if their stomach is full, they are done. If you give them food, they won't eat after that. Correct? So instead of always running for things and wanting things, chasing that position, chasing that money, chasing that power, what should we do? Any guesses, guys? Please, this is an interactive session, so please write down on the comment section whatever you're thinking. Write down. Any guesses what we should do when we want something? When you want something, that is the time to visualize it in your mind, accept that you have it, your goal, and then let it go. इसलिए ये जो letting go meditation है, it's very very important today, because we need to know the process of visualizing our goal, being content with it, and then letting it go. Where letting it go? You guys are saying, what is she telling us? We want something and I'm telling you to let go? Yes. Let go to God. Let go to the ultimate source of power. Let go to the universe. Even if you don't believe in a higher power, just letting go onto the universe. Because the more you try to chase things, the more you try to hold the sand, the more it's going to slip out of your hand. So the more you try to chase things in life, the more it's going to slip out of your hand. Yes, manifestation means you visualize it in your mind, you have it in your soul, and then you let go out of it. You don't chase it. You don't get greedy for it. Because what happens when when you get greedy for something and it doesn't happen, you get shattered. So that is one thing. Greed, we came across, that we should definitely take care of. Second point, self pity. आजकल क्या ट्रेंड हो रहा है गाइस? कुछ कमेंट्स में प्लीज लिखिए. आजकल हमारी दिल्ली मोस्टली क्योंकि मैं तो दिल्ली से हूँ, तो हमारी दिल्ली सिटी में क्या हो रहा है? इतना जोरों शोरों से आजकल क्या हो रहा है? Any guesses? Weddings, शादियां हो रही हैं, ट्रेंडिंग. एंड उसके बाद क्या हो रहा है? अगर शादी नहीं हो रही है तो रिलेशनशिप्स हो रहे हैं. ठीक है? एंड रिलेशनशिप्स हो रहे हैं. एंड कैसे हो रहे हैं रिलेशनशिप? आजकल जब कोविड टाइम पे रिलेशनशिप्स कैसे बने? थ्रू द डेटिंग एप्स मोस्टली. अगर आप रिसर्च, ये जो मैं आज सारा बोल रही हूँ, ये गूगल के फैक्ट्स हैं, इंटरनेट के फैक्ट्स हैं, रिसर्च करे हैं मैंने. आप ये गूगल कर सकते हैं जो भी मैं बात कर रही हूँ. ओके, or you can search for yourself wherever you want to. So in the 2020, all the dating apps, they were highly used, more used than before, than regular. They were used, and people were going on dates and doing internet chatting on the social media sites and the dating apps, and then on the WhatsApp, and then going on the dates, and then quickly, what is happening after the dates? What is happening after the dates? People are rushing into the saint practice, the saint entity of marriage. They are rushing towards marriage and getting married very quickly. Why are they getting married so quickly? Isn't that happening in the whole of India right now? देखो, मैं इंडियन हूँ तो मैं इंडिया से ही बात करूंगी. If you're watching from some other country, then I'm sure it's happening there as well. But because I'm from India, I can only speak about my own country. So, don't you think this is happening? all over India, that people are getting extremely rushed into relationships and marriages. And then what's happening, guys? Because why is this happening first? First, why is this happening? Then why, what's the result of this? First, why is it happening? Because of fear of being alone. This pandemic made so many people lonely. And fear of being alone का क्या मतलब होता है? मैं तो अकेले ही मरूंगी या मरूंगा. I will die alone. That is the fear that is happening nowadays. And a big lesson from the pandemic, that I will die alone. But guys, please shake yourself up. We are going to die alone. Obviously, we are going to die alone. Is my father or mother going to die with me? No. Is my dog going to die with me? Or any kind of pet? No. Is my other half or my partner going to die with me? No. You came alone in this world. You will go alone only from this world. So fear of being alone or fear of dying alone, please take out. You are going to die alone, whatever you do, how many ever marriages you do, or how many ever kids you have. Because death is not up to us, guys. And life is not up to us. This is all on the universe and God and supreme power. So we'll just let it go again onto that. So what happened when people get married very fast, they realize that partner is not good for them, and then it's leading up to divorce. जितने marriages pandemic में हुए हैं, उतने ही divorce pandemic में मतलब it's led after the pandemic हुए हैं. तो डिवोर्स के बारे में कोई बात नहीं करता, सेपरेशन और फेलियर के बारे में क्यों कोई बात नहीं करता? दैट्स इम्पोर्टेंट बिकॉज इट अफेक्ट्स अस मोर, राइट? नेगेटिव चीजें हमें ज्यादा अफेक्ट करती है पॉजिटिव से. तो क्या होता है जब रिलेशनशिप फेल होती है, तो एक बहुत बहुत ही बड़ा ट्रेट हम अपने आप में लाते हैं और नेगेटिविटी कॉज करते हैं. दैट इज सेल्फ पिटी. सेल्फ पिटी. हम अपने आप में जब कुछ फेल होता है तो हम अपने आप में नुक्स या खामियां या बैड क्वालिटीज निकालते हैं. मैंने कुछ गलत करा होगा, मैं सुंदर नहीं हूं, या मैं उसके लेवल तक नहीं हूं, या वो मुझसे बेटर है. सो या मेरे में ही मैंने ही कुछ गलत करा होगा, राइट? हम क्या करते हैं जब कुछ फेल होता है, वी स्टार्ट ब्लेमिंग आवरसेल्फ, एंड दैट इज नोन एज सेल्फ पिटी. And what should we do when we're having self pity? Not have self pity, let go. If something has failed and not worked out, feel the emotion, feel the pain, and after you feel it, understand the pain, understand, and then let go. Let go. ओके. तो एक तो हमने ग्रीड के बारे में बात करा, एक सेल्फ पिटी के बारे में बात करा, फियर ऑफ डाइंग अलोन. थर्ड चीज, anybody can tell me who is watching us today, what is the word karma? What is karma? कर्मा क्या होता है? एक वर्ड पे प्लीज नीचे कमेंट सेक्शन में लिखिए, कर्मा क्या होता है? Any guesses? Karma is the intention behind your action or thought or emotion. Karma is the intention. That's it. तो कर्मा ये नहीं होता कि लोग कहते हैं कि what goes around comes around, or my action is the karma. No, that's wrong. Your intention is your karma. Whatever you do, if you do it with the right and good intention, you will always succeed. There is a right, there is a wrong. That is a basic knowledge. As humans, we know what is right, we know what is wrong. We are not dumb guys. We are educated, we're literate, even the illiterate, even the people who don't have the opportunity, they know what is right. It's a basic instinct, basic intent. राइट ये है, रॉन्ग ये है, सबको पता है. ठीक है, तो मैं कह रही हूँ राइट पाथ पे जाओ. थोड़ा लॉन्ग और डिफिकल्ट हो सकता है, but at the end the right path is going to lead you to the good positive life, positive future, rather than the wrong path which seems very easy and attractive but leads to failure. For sure, for sure. If you go in the wrong path, at the end you will fail for sure. So having that right intention will purify your karma in your life. And we all have the karmic debt. Okay. That we'll speak about the karmic debt some other time. It's a big topic about how we all are reborn and reborn and reborn because we have some karmic purification to do. So what should we do in this life that we have? First, be gratitude and grateful that we are in this life. Thank you so much. To who? To us? Yes. To ourselves, thank you. Have gratitude. To each other, thank you. Have gratitude. To the supreme power universe, God, have thanks. Have gratitude. And if we have that opportunity to be present on this earth, then after that, what we do? Take the right path. Take the right intention. Purify our karma. Okay. So again, greed, self-pity, fear of dying alone, karma. Fifth, mental health. And especially during the COVID time, mental health during the COVID time. COVID has taught us a lot of things about ourselves. And main thing we need to do is let things go, not keep in our system, in our body, crunched. Then some people come to me, I have shoulder pain today. I have head pain today. I didn't sleep. I cannot sleep properly. Tell me yoga asana to sleep properly? This is stupid. Obviously, because you're keeping things in your mind and body, and that is why not able to sleep, and that is why having a pain on your shoulders and your head and all parts of body, and getting problems, health problems, because you have kept so much of burden. So let go, guys. This is the meditation of letting go. Just visualize. If you want something, then visualize it and then let it go. If you don't want something, simply exhale through your breath. Inhale, exhale through your breath and let go. Okay? So I hope we all understand what are the topics we need to work on ourselves. These are common topics that everybody doesn't realize but happens very frequently. And then also letting go is something that with regular consistency and practice we should do. And through the Vedanta, जो वेदास के हैं, according to the Vedas, अभी कलयुग चल रहा है. We are going through the period of darkness, Kalyug, Kalyuga. And that is all the wars and the negativity and everything. So meditation is very, very important, guys, at this time. Keep yourself calm, positive, and a happy being through the process of yoga, through the process of meditation, through the process of letting go. Okay, तो मैंने काफी बात कर ली है इसके बारे में. Okay, so अब हम chant करेंगे. You can take your pillow and just come on the edge of the pillow and just keep it under your hips. Edge of the pillow under your hips. And back straight, hand chin mudra, roll your shoulder back, take a nice and long yogic breath. Inhale, expand the abdomen, lungs, chest, throat. Exhale, release. Inhale. Exhale. Inhale through the nose. Exhale through the nose. Inhale through the nose. Exhale through the nose. Let us take a couple of minutes, close our eyes, keep our body still, keep our mind still, come into the class fully, mindfully, with awareness, with mindfulness, with 100% consciousness, relax and chant. Oh. ॐ त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् उर्वारुकमिव वन्दनाम् नित्योर्मोक्ति अमृता. Palms together, rub your palms to your eyes, face, rest of body, and you will just do a Nari Shodham Pranayam. So you take your right thumb and take on your right nostril. You will inhale, exhale through the left nostril 10 times. सिर्फ left nostril से inhale, exhale करना है. Right nostril को block करेंगे. Let's start. Inhale, exhale. Deep breath. 2. Keep your back straight. 3. 4. 5. 6. 7. 8. 9. 10. 5 more. 4. 3. 2. 1. Relax. Take a long breath, normal. Inhale, exhale, yogic breath. Take your left thumb to the left nostril. Inhale, exhale through the right nostril. Slowly and deeply. 1. 2. 3. 4. 5. 6. 7. 8. 9. 10. 5 more. 4. 3. 2. 1. One more. Relax. Take a nice and long breath. Inhale. Exhale. Inhale. And take your chin to your chest. Hold your breath. Stay here. Control your breath. Relax slowly. Exhale. Inhale deeply. Exhale completely. And second pranayama, you will inhale through nose and exhale through mouth very slowly. So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 5 more, 4, 3, 2, 1. Relax. Take a nice and normal yogic breath. One more deep. Chin to chest, hold your breath, control, stay. Relax slowly, exhale. Inhale, exhale. Take your hands on the upper thighs, lean a little bit forward. You will exhale vigorously through your mouth. So let's go. 10. Yeah. 9, 8, 7, 6, 5, 4, 3, 2, 5 more, 4, 3, 2, 1. One more. Relax. Inhale and exhale. Relax your body. Relax your mind. Slowly rub your palms together to your eyes. Slowly open your eyes to your palms, rest your body. Look at your palms. Thank you. So यहाँ से you can just move your legs a little bit. Up and down. Ankle rotation 5, 4, 3, 2, 1. Other side 5, 4, 3, 2, 1. Front and back. Shake your hands. This rotation 5, 4, 3, 2, 1. Another side 5, 4, 3, 2, 1. And hands and feet together, exhale, mount 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. One more, relax. Very good. So you can just remove your cushion. Just we do couple of stretches. So you sit in Siddhasana, one leg in front of the other, hand on the thigh. Inhale, stretch your tailbone forward, full body rotation. Exhale, back, 5 rounds. 2, 3, 4, 5. Other side, 5, 4, 3, 2, 1. And slowly relax. Inhale, exhale. And from here, you just drop your forearm down on the mat and stretch your body outward. Twist left arm all the way over the head. Look to your palm, stretch your arm. Breathe for 10. Side stretch. 9, 8, 7, 6, 5, 4, 3, 2, 5 more. 4, 3, 2, 1. One more. Exhale. Slowly come back. Relax. We'll do the same on the other side. Drop your left forearm. Twist your body. Right arm all over the head. Look to your palm and stay for 10, 9, 8, 7, 6, 5, 4, 3, 2. 5 more. 4, 3, 2, 1. One more. And one more. Relax. Slowly inhale, exhale. We'll do 4 rounds of neck rotation. So let's go. Inhale right, exhale down left. Big circle. 2, 3, 4. Let's do the other side. 4, 3. Big circle, guys. 2, 1. Relax. And take your head to the right side with the right hand. Pull down. Relax. Left side. Pull down. Relax. And shoulder rotation. Hand on shoulders. Inhale back. Exhale. Touch the elbows. Big circle. 2. Back straight. 3. Other side. 3, 2, 1. Very nice. Spinal twist करेंगे just to open up the spine. Right hand up, stretch up, take on your left hip. Left hand behind your back. Twist and look back. Lift your tailbone. Breathe for 10, 9, 8. Keep stretching back. 7, 6. Feel the spinal twist. 5, 4, 3, 2, 1. 3 more. 2, 1. And relax. We'll do the other side. Left hand up, stretch up. Take on the right hip. Right hand behind your back. Lift up and look over the right shoulder. 10, 9, 8, 7, 6, 5, 4, 3, 2. 5 more. 4, 3, 2, 1. One more. And slowly come back. Take both your hands behind your back and lift your tailbone. Drop your head back. Stretch your back for 5, 4, 3, 2, 1. One more. Exhale, come back. Interlock your hands and stretch your hands up. Look to the, come to the right. Inhale up. Come to the left. Inhale up. Twist to the right. Inhale up. Twist to the left. Inhale up. Relax. Okay. So now we have a little bit body stretch. You're going to lie down into Savasana and put the cushion under the part of your body that needs healing. I'll just show you what is Savasana. It is lying down on your yoga mat with your feet hip width apart, your head relaxed, and your hands away from your body, your eyes closed. And for example, if you have lower back pain, so you can just put the cushion under the lower back and then come into Savasana and relax. Okay, so let's lie down on a yoga mat, close our eyes into Savasana and take 5 deep yogic breaths. Inhale, really expand your stomach, lungs, chest, throat. Exhale, release. Inhale, expand. Exhale, release. Inhale, exhale. Inhale, exhale. Inhale, exhale. And you will be simply just listening to my voice in the same Savasana position. Keep your eyes closed till I give you the further instruction to open the eyes. So please keep your eyes closed, being completely aware of your body, of your mind, of your meditation practice, and keeping in mind all the things that we previously talked about, all the issues, and slowly and steadily relax your body completely, relax your feet, relax your legs, relax your knees, relax your thighs, relax your hips, relax your pelvis, relax your entire lower body, and relax your back, relax your stomach, relax your chest, relax your arms, relax and completely surrender your body onto your yoga mat. Feel your body get heavy and drop deeper and deeper into your yoga mat. And relax your neck, relax your head, relax your face, relax your entire body. Keep taking deep breaths through your nose. Inhale through your nose, expanding the stomach like a balloon. And exhale through your nose, completely releasing your stomach. Relaxing your hair, relaxing your entire body. And now slowly moving the awareness onto your mind, relaxing the mind. Through your breath, entering your mind. And slowly you can see thoughts coming in the mind, and any kind of emotion coming in the mind. Let it come. Don't stop the mind from thinking. It's okay. It's very natural. The mind is made to think. It's a muscle made to think. So if the thoughts are coming at this point, it's okay. Let it come. But you, in your meditation as an observer, watch the thoughts as an outsider, as from your soul. Your thoughts are a part of you. They are not you. So watch them as they are apart from you, coming in your mind. And then as you're watching your thoughts come, watch them leave. Let them leave your mind. Do not react to your thoughts. Do not become a servant to your thoughts. Let your thoughts go. and any kind of emotion that is coming in your mind or you feel heavy, this is the time, guys, to let it come and let it go. Just take deep inhalation and deep exhalation and let all of that leave your body through your breath. And slowly you feel lighter in your mind. You feel your mind more empty and still, and your mind feels at ease. Your mind feels relaxed. And anything that we really want or need in our life, let us now visualize that and then feel ourselves being completely content and happy in our mind, probably having a little smile on your face, imagining that thought, that goal in our mind at this time, feeling the utmost contentment. And now slowly let that visualization go into the universe through your breath. Exhale and let it go onto the universe, onto the God. And now that your body is completely relaxed, your mind is completely relaxed, and you feel light and you feel all your thoughts and issues out of your mind, out of your body. Let us imagine a white light entering the mind, entering the body at this point. Feel that light being positive and spread all over your mind and body and soul with positivity, with happiness, with gratitude, with love. Just let that white light come all over each and every cell of your body and mind. Just let it come all over and spread all over. Seeing that light in your soul now, feeling nice, feeling so relaxed. Just stay with that positive light, that white light, for a couple of minutes. Just relax, relax, relax. slowly and steadily, keeping your eyes closed, just being with your body, being with your mind, being with your soul, feeling so content and relaxed at this moment. Appreciate this feeling, having gratitude for this feeling, letting this positivity spread in our body and mind and soul completely. All the richness and goodness of energization, reorganization, reinvention, and love taking over our body, mind, and soul, feeling of happiness and calmness. Let us welcome all these amazing attributes into our soul, completely embed them in our soul, and being kind, being generous, being loving, being happy, being calm. Let us have all these amazing attributes into our soul. We will just stay here and just chant so that all these feelings really seep inside our soul at this point. सवासन में chant करेंगे. Relax. Take a deep inhalation and exhalation, yogic breath. Feeling that part of the body that needed healing, completely healed, completely relaxed, having a slight smile on your face. Slowly move your feet and your hands. Slowly move your head side to side. And slowly taking your body together and moving to the right side. अपने right side पे बैठिए and slowly sit up, keeping your eyes closed. Please don't open your eyes, keeping your eyes closed, being in that happy space, still feeling that white light at the back of your mind, in your soul, forever it shall reside. Palms together into gratitude. We'll do the ending mantra. Take a long breath. All the goodness within you. Om. 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 ॐ पूर्णमिदं पूर्णमुदच्यते पूर्णस्य पूर्णमदाय पूर्णमेवावशिष्यते Shanti, Shanti, Shanti. Palms together, rub your palms, creating heat between your palms. Take it to your eyes. Just stay here for a second. Take a deep breath. Coming back to life with all the goodness within you. Open your eyes slowly in your palms. Then take your palms to your face. Take your palms to the rest of your body. Look at your palms. Come into gratitude. Thank you so much, everybody. Om Namah Shivaya. Thank you for this lovely session.
Thank you so much, Meher, for this beautiful morning filled with positivity. And I would like to say that it was a really, really great session and a lot of great positivity on a Sunday morning, definitely.
And
And thank you so
I
much for
think
being with us. Yes, please tell me.
एंड आई थिंक आज मैंने 2 मिनट पहले छोड़ दिया है. मैं हमेशा एक्स्ट्रा टाइम लेती हूँ, तो आज मैंने अपने आप को बहुत कंस्ट्रेन करा. एक्चुअली जो लेटिंग गो मेडिटेशन है, इट्स देयर फॉर एटलीस्ट 45-50 minutes, but because we had a time constraint, so that's why I had to pack it up, because even the issues that I spoke about is all a part of the
Yes,
meditation, right?
very
Because these things we need to let go. And
absolutely.
thank
Which
you
is
so
very
much.
important now. And on that note, also, if we can take on screen Dr. Shrikant, who will be speaking on neurological disorders, chronic neurological issues which people are facing now during pandemic. So it will be a continuation of Panacea sessions. So, Meher, thank you very much for your time and giving us the entire month. And we would
Thank
definitely.
you, and please do follow me, everybody who's watching on Panacea, Yoga Connect by Meher, Yoga Connect by Meher on Instagram, yogaconnect.org, my website. You can contact me for workshops and yoga classes, meditation classes. Thank you so much, Pooja. Over to
Thank you
you.
so much. Thank you. Thank you. I welcome Dr. Srikrant, who is associated with Narayana Health, and welcome to the show, sir. And I would like to leave the screen to you, and he'll be speaking on neurological disorders. So, sir, I guess you have a PPT to share. Yes. So, sir, I leave the screen to you, and you can take over the session now.
Sure, sure. Yeah. Hi, Pooja. I'm Dr. Shrikant Venkatakrishan. Hello, everybody. Um, I am a rehabilitation physician. Basically, we work with patients with chronic issues which require assistance for the daily lives, and we try to reduce their caregiver burden and improve their independence of in their activities of daily living. So it's a team effort. The physician directs the program, and it is executed by a team of therapists. So this is something about the branch. Um, Let me just share this. Is the presentation visible?
Yes, it is visible. It is
Sure.
visible.
So, one thing which I've seen in the last year or so of this pandemic is that a lot of people come to me after several months of not having visited the doctor or seen a therapist. And either the patient or the caregiver says that, oh, it was, we thought it was unsafe to go out, we would catch the infection. As a result, they would miss their follow-up visits, and even the basic exercise program would be lacking. And a lot of these people ended up with certain complications, such as contractures or intractable pain. And this is something which has been caused by the pandemic and the conditions it has imposed. So, what I'd like to do today is to share with you some basic information on what are the components of a basic program to maintain physical function in those with chronic neurological conditions. So I won't be talking about the disease or its management per se, but how do you manage the residual deficits of the disease? So when you talk about neurological disorders, you have disorders of the brain, the spinal cord, and the peripheral nerves. When it comes to the brain, commonly you have diseases like stroke, neurodegenerative conditions like Parkinson's or Alzheimer's, multiple sclerosis. For the spinal cord, you can have transverse myelitis, disorders that cause pressing of the spinal cord, such as osteoporotic fractures, tumors, or traumatic injuries. And when it comes to peripheral nerves, you can have diseases like Guillain-Barré syndrome, which affects nerves, the peripheral nerves diffusely. You can have diabetic and other neuropathies that are related to rheumatological disorders. So, whatever is the cause of the disease, a lot of them have certain common presentations and common impairments, which in layman terms can be put as you can have weakness that is either focal or diffuse. You can have pain localized to a certain joint or diffuse body pain, pain localized to the distribution of a certain nerve, and each of these kinds of pain have different characteristics. You can also have tightness, which can be of different kinds. In stroke, you can have something called spasticity, where there is focal tightness of certain groups of muscles, as is seen in the picture here. The arm is held inside, and the wrist and fingers are locked in. You can have rigidity also in the case of Parkinson's, where there can be diffuse tightness and general stiffness while moving. Most of these people also have imbalance while walking or during standing, during transitions, and uh, during moving during the daily tasks. You can also have speech, language, and communication issues, bladder and bowel incontinence, which might require either a conduit catheter, or indwelling catheter, or the need for diapers and continued skin care. They might also have problems with taking care of their skin in view of poor mobility and poor sensory functions. In addition, patients with diabetic neuropathy may also have a risk for ulceration of their feet and requires good foot and skin care. So, what has COVID done? It has caused restrictions in mobility, which prevents people from accessing these services regularly. So, their follow up visits are delayed. Therapy services might be available, but there might be doubts as to whether it is safe to go there or not. And regular follow up is also lost. And a lot of patients come to me asking whether it is safe to go for therapy sessions. Well, there is no guarantee on that, but the key thing is to take care of all precautions such as mask wearing, hand hygiene, and as much as possible maintain physical distance during travel. And most centers do tend to take care of infection control measures in their place safely, but that is a genuine concern. And there's also lack of awareness as to what constitutes basic care program. So all these tend to result in certain complications, such as contractures. When you have a limb that is perpetually tight, after some time, after a few months, you may not be able to stretch it out. So if recovery happens and the limb can be moved, the contracture prevents from gaining function. So sometimes such people would require surgeries to correct that contracture. You can also have deconditioning. If the muscles don't move, if you don't use them, they become wasted and atrophied. And as a result, mobility and general function of the limb is impaired. As a result of this, there is a progressive decline in function, which can also have a domino effect on other metabolic parameters such as glycemic control, blood pressure control, and all of this places increased burden on the caregiver and the patient. So, patients with neurological disorders can belong to any of these categories, where you can have people who are bedbound and require maximal assistance for their day-to-day tasks. A lot of people are able to be independent on a wheelchair. They can probably transfer onto the wheelchair and move around inside the house and go to the toilet, but with the assistance of wheelchair, which is either caregiver propelled or self-propelled. And you have a group of people who can walk indoors but may not be able to walk outdoors. Community ambulant patients generally in stroke, when I see if they're able to walk at a speed greater than zero point 0.8 meters per second, which I measure out while they visit the clinic, such people can move out safely in the community. So you have four different levels of functioning in people with
Sir,
chronic neurological condition.
I would just like to interrupt. I think the PPT which you're presenting, it's not going forward. Yes,
Is
now
it?
it is. Yes, yes, yes. Now it is. Yes, it's visible right now.
All right.
Yeah.
Just
Thank,
give me a minute.
yeah.
Is it moving now?
Yes, it is. It is.
All right. So, whatever the level of functioning, there is a basic structure of a function or exercise program that we would prescribe for neurological disorders. And we look at these components, which is basically ensuring mobility of the joints, maintaining strength and quality of movement, maintaining trunk balance, aerobic condition, or the ability to do exercises without getting exhausted, general function or activities that relate to daily living. We also look at the need for assistive devices, which include wheelchairs or gait aids or splints that help with ambulation. We also advise on care of tubes if they are present, such as an indwelling urinary catheter or feeding tube or a Riles tube, and general advice on how to manage comorbidities. So, when it comes to joint mobility, if you do, if you're able to move the joints of all the joints of the upper as well as lower limb for 2 to 3 sets, each having repetitions of 10 to 15 through all the ranges of motion that it has. For example, at the wrist, simple wrist flexion and extension, elbow flexion and extension passively, and shoulder stretches to as much pain-free motion and as much that the joint allows without stiffness. If you are able to do that 10 to 15 times per set, 2 to 3 times a day, that would ensure a basic mobility of that joint. In addition, if there is some tightness, what you could also do is to do sustained stretch. For example, if somebody with stroke has a hand positioned in this way, you could passively stretch it out, hold it for 5 to 8 seconds, relax, and then repeat. So that would be for the wrist, and repeat around 10 times. The same for the elbow. Again, somebody with stroke may have the hand in posturing this way. So if you could stretch out the elbow, hold for 5 to 8 seconds, and then repeat 10 to 15 times. Shoulders are commonly extremely tight in stroke and Parkinson's. So if you could position to as much range that is available, hold at that point for 5 to 8 seconds, and then repeat. That will ensure a basic joint mobility and stretching program. The same is to be done for the ankles, knees, and hips. When you do this, make sure that there is no swelling or redness of the joint. If there's severe pain, you probably need to contact a local doctor, an orthopedician, or a therapist who can help you out to safely do these exercises. So strength training is another important component. It doesn't mean that you need to go to a gym. Even moving the limbs in the active range, as much as can be done, is also a form of strength training because gravity provides the resistance. So, moving each limb for a total of 10 to 15 repetitions, 2 to 3 sets per day, is a basic exercise program. So, even if somebody is bed bound or wheelchair bound, ensuring that this basic movement is done is a start of strength training. In addition, if the person is able to do it, you could use weighted cuffs, which are freely available in the market. They come in weights of 1 to 2 kilos. Certain people with heart conditions need to be careful while lifting weights. So before you go in for weight training, if you have several comorbidities, make sure that you ask an expert personally so that it can be tested and then tried out. But these weighted cuffs can be tied to the wrist or the elbow, and each of those joints can be moved through its full range. And if you can do that without getting exhausted, without feeling pain in the limbs, or without any cramping, that is also a good start for strength training. Commonly, people with stroke have weakness of one side. It's not that there is no movement of that side. So even active assisted range of motion is helpful. So if somebody has difficulty in extending their elbow, you could, as they are extending, you could help them out by guiding the limb through that range of motion. And the same thing for the shoulder as well. When it comes to balance training, we're talking about balance while sitting, standing, and walking as the functional status of the patient may be. So basic exercise for sitting balance include just supported sitting with their arms propped up at the side of the bed, with their legs dangling down from the bed, and if they could just move from side to side. And as they are held, as they are sitting, it's important that if there is a tendency to fall, you prop them up with supports or somebody sitting by their side as this exercise is happening. Once you can safely ensure that static sitting is good, you move on to dynamic sitting exercises where you go for reaching activities. So while you're sitting with your legs dangling down, try to reach out for a tumbler or a cup which is placed in front of a table, and then shift it from side to side. And to make things more challenging, you could also do ball catching activities in sitting. So these are some activities for basic sitting balance. When it comes to transitioning from sit to stand, the basic exercise that needs to be done is rocking back and forth, making sure that they can shift position antero-posteriorly as well as from side to side. And one thing which can also be done is shuffling on the bed from one position sideways to another and then move backwards. And once a person is able to stand safely, you focus on endurance while in standing. So increase standing duration from between 5 to 10 minutes at a time to as much can be tolerated. And in standing, you can practice shifting weights from one side to another and also focus on single limb standing. Now, when you do single limb standing, it's important to make sure that the person can stand, tolerate weight shifting. So, if there is a table support or a chair support and somebody to supervise nearby, this exercise helps to build not only the quadriceps or the knee strength, but also helps with balance training in standing. So aerobic condition refers to any exercise that builds the cardiovascular function, and it could be anything from repetitive cycling movements while lying on the bed to leg raises in supine. So you can lift both legs one after the other, for about 20 to 30 repetitions or up to a minute. Make sure that there is no breathlessness or any pain, chest pain or limb pain while these exercises happen. Simple stepping exercises by the bedside for a minute or two. Cycling exercises, so you have this standard stationary cycle or hand cycle, which is freely available in the market, costs anywhere between 1000 to 1500. And this done without resistance for about 10 to 15 minutes is also a good way to maintain aerobic condition. And for those who can walk, walking as much as tolerated for around 10 to 15 minutes. Ideally, if somebody is community ambulant, then we recommend that they walk for up to 150 minutes per week in 3 to 5 divided sessions. So that would mean either walking for 30 minutes for 5 days of the week. When it comes to general function, we divide the daily tasks into bed mobility, coming to sit, sit to stand, grooming, feeding, dressing, bathing, and toileting. So, for somebody who's bed bound, rolling from side to side with rotations of the pelvis is a basic exercise for bed mobility. Coming to sit entails rolling over to one side and using the triceps muscle. So you can push against the side of the bed and then gradually come to sit. If you have difficulty in doing that, then you can use either ropes or rails by the side to help to come to sit. Repetitive motions of sit to stand with support will help with transition activities. And if you have difficulty in grooming or feeding, certain adaptive devices also help to make tasks easier. An important activity to, important thing to make sure when people are going to the bathroom or during toileting tasks is that the floor is not wet and you have grab bars or something to grab onto during transitions. So these are some of the commonly available equipments. So if you have difficulty in reaching out behind to comb your hair, a long handled comb is helpful. If you have grip weakness, you can use built up devices or pens or spoons with built up handles so that gripping becomes easier. And you can also use Velcro straps lined into the clothes, which will help with dressing. And what you see here is a button hook where you can insert through the button and pull the button uh, through the eyelet. When it comes to management of tightness, you have, as I said, two different kinds of tightness. You have spasticity and rigidity. A basic program to ensure that the limb doesn't go into contracture is sustained stretch, as I mentioned. If you can do that for 5 to 8 seconds, repeat 10 to 15 times, 2 to 3 times a day. So each set of 10 to 15 needs to be repeated 2 to 3 times. That will ensure that even if you don't have a splint, the limb is maintained in some kind of mobility. Icing on the belly of the muscle. It's important that you don't ice the tendon, but only on the belly for rubbing for around 10 to 15 minutes helps to reduce the tone and maintain a supple muscle. Certain relaxation techniques also help. For example, deep breathing and pursed lip breathing, where you inhale through the nose for 3 seconds and then breathe out for a longer period for 4 to 6 seconds. So inhaling through the nose and breathing out with pursed lips. If you repeat this for around 8 to 10 cycles, 3 times a day, that also helps a little bit with relaxing the muscles. It's important that if the limb is not functional, then it can be splinted with commonly available splints such as a resting hand splint or an ankle foot orthosis that helps to maintain the joint in that range. So the limb can be positioned with the splint during sleep between 6 to 8 hours. And If you have any difficulty in procuring these devices, please contact a local physician or a physiotherapist who can help you out with this. Commonly occurring painful conditions in stroke and Parkinson's include frozen shoulder and osteoarthritis. So it's important to maintain joint mobility with gentle range of motion exercises. Make sure that posture is always good while sitting. Make sure that you're not slouching, the shoulders are not drooping forwards. Make sure that the shoulders are out as much as possible, and you sit with a good firm backrest. Certain splints can also help. In stroke, sometimes what happens is that the shoulder joint goes downwards and slips off from the scapular bone. So there is a splint that is available that helps to keep the shoulder back in position, which is called a humeral cuff. And in osteoarthritis, you can also use silicone knee sleeves or compression bandaging to help with the pain. And you can also use commonly available gels or sprays to control the pain. And if with all these measures you don't get pain relief, then you can contact your physician who will help you with medications or injections. And a lot of patients who have mobility issues might require wheelchairs or gait aids. So there's not much clarity available on what kind of wheelchair is good. So generally people pick up whatever is available or what they order online. Some considerations that you need to take care of are wheelchair with removable or swing away armrests are always better because they help to transfer sideways better. So you have the armrest on the wheelchair. If that can be removed, then you can easily shift the patient from the bed to the wheelchair. When it comes to gait aids, there are different kinds of aids. So you can use a quadrupod cane or a hemi walker when balance is severely affected. And people with Parkinson's, they can use reciprocal walkers or simple walkers. Splints that are commonly used include a resting hand splint, humeral cuff, that is to maintain shoulder and hand range. Gaiters, which are knee immobilizers, knee and elbow immobilizers to ensure that standing is safe. Ankle foot orthosis or splints for the leg to keep the ankle in a functional position. And commonly used exercise items that are useful at home include hand cycle and exercise bands or therabands. Before you use any of these devices, it's best to contact your primary care provider.
So your PPT is still not forwarding again. Yes.
Sorry?
So the PPT was not moving forward actually, just a
From
reminder.
when? From when? All right. Where is it right now?
So it's in tube care. We can see tube
Right.
care. Yeah.
Okay. Do you want me to repeat a few of them?
So that's all right. So you can continue, but the slides are not being forwarded. That's just a
Sure.
reminder.
Sure. All right. So a lot of the patients with neurological disorders tend to have an indwelling catheter or a Riles tube for feeding. When you take care of a catheter, make sure that not more than half of the urosac bag is filled and empty it before that happens. And do not raise the bag above the level of the bed or the level where the pipe exits from, because that can cause reflux of urine. And that might lead to urinary tract infections and further complications. Make sure that the catheter tube is cleaned daily, or the whatever yellow or white portion of the tube that you see is cleaned with a saline gauze from end to tip at least once a day, and that there are no crusts on the catheter tube. And usually a catheter needs to be changed every 3 to 4 weeks at home. But if you notice that there are a lot of sediments or color changes within the tube, it's probably time to change the tube. For the Riles tube, make sure that you flush it with water uh, around 20 ml every time you feed. And a few times a week, it can also be flushed with simple soda so that solid sediments do not obstruct the tube. And the Riles tube can be changed every 3 to 4 weeks. Is the slide moving?
yes, it's moving.
So when it comes to care of comorbidities, it's important that you have a list of all the medications that are available and that are need to be given for the patient, and make sure that either through teleconsult or personal visits, you have routine checks with the primary physician. And if you or the patient develops certain red flags such as increased drowsiness, fever, cough, or reduced appetite or reduced urine output, please make sure that you contact your primary care provider. So some of the causes of drowsiness include hyponatremia, or electrolyte imbalances, infections. Fever and cough in this setting could be because of an impaired swallow, and recurrent infections could lead to reduced appetite and lethargy. And if you have renal issues, that could be manifest as a reduced urine output. And it's important also to take time out for yourselves, because taking care of somebody with a chronic condition can be burdening. And make sure that as much as possible you have a good diet, sleep well, and unburden yourselves in either through prayer or meditation, because it's important to take care of yourself, to make sure that your functioning is not affected by all of this. And if you have any doubts, please contact your primary care provider or a therapist to help you execute a basic exercise program. So, in conclusion, you need to make sure that people with chronic conditions follow basic activities at home so that you prevent complications, maintain function as much as possible, and seek help when required. Thank you. So, if there are any questions, I'll be happy to answer them.
Yes, thank you so much, Dr. Shrikant, for this wonderful session and imparting so much of knowledge right now for the neurological sector. So, if you can kindly elaborate on the kind of symptoms on various age groups, especially during this pandemic time. What are the basic symptoms of neurological disorders in every age bracket, basically?
So,
Starting
commonly,
from
like if you're looking at, if,
young age and old age, both.
right. So, in when it comes to stroke, generally you look at any facial deviation. If you're unable to lift the arm and there's a fall of the arm, there's slurring of speech, or there is a dragging while walking. When there is a, you're unable to keep the foot flat, the foot drags. These are common symptoms of presentation of stroke. They can also be subtle. It's not necessary that they should occur altogether. If you notice any new change in the speech or any symmetry of the face or reduced dexterity, that is probably time to act soon and go to a neurologist or a general physician. Um, so when it comes to Parkinson's disease, it's a slow progression, but generally tends to affect with tremors of the hands, any postural imbalance. When you walk, there's a tendency to fall backwards or to the front, and they might also have dizziness while standing, which is called orthostatic hypotension. So sometimes patients, when they tend to get up, they might feel that the head is spinning, things are blacking out. So it's important to have the blood pressures checked in supine as well as in standing. And commonly, you could also have subtle or um, very evident seizures, which are involuntary tonic-clonic movements of the limbs, or loss of periods of loss of consciousness. So you could also have sudden pain affecting certain distribution of nerve, burning sensation. Um, any loss of bowel and bladder function is also something to be looked at. So any of these symptoms, please visit a doctor as soon as possible.
So, regarding any kind of Alzheimer diseases as well, which is growing up to be a very quite a common disease now amongst all every age bracket as well. So, if you can tell us about that as well, um, a bit more information on Alzheimer's, if you can elaborate.
So again, Alzheimer's is a condition that progresses slowly and generally manifests with cognitive symptoms, where you have um, difficulty in remembering recent events. So they may forget that they've had breakfast. They might forget to flush the toilet, or personal hygiene might be affected. So that is noticed gradually by the caregivers, and you may notice that uh, they may not take care of personal hygiene, and social continence for bowel and bladder might get affected.
Right.
In addition, sometimes it's important to make sure that they have an identity card or something with them, so when they go out to the shop, or go out somewhere, they don't get there's a high chance that they might get lost and lose directions. In that situation, there's a caregiver who could help them by looking at the ID card and call the person whose number is mentioned in the card. So these are some of the things that could happen with Alzheimer's disease. Again, cure for this is difficult. It's about managing the symptoms, counseling the caregivers, and having basic cueing and psychoeducation for the patients and the caregivers to manage these symptoms. There are some medications that can help to sustain function, but they're of limited use. It's important to maintain general physical function with a basic exercise program at home, to manage the diet and sleep, and seek help with the psychologists to address the cognitive issues.
So, anything on the infrastructure? Um,
Sorry?
anything regarding the infrastructure of the hospitals in India right now, dealing with these kind of disorders and these kind of treatments, the kind of treatment we are doing right now.
Sure. So it's very
Infrastructure.
variable. It's very variable when it comes to neurological disorders and its rehabilitation. Comprehensive care is available mainly in tertiary care centers in big cities, which are again not limited to all which are not available in all hospitals. We have only two or three hospitals in every city that uh, take care of comprehensive rehabilitation services. You have big hospitals such as Nimhans and CMC, Narayana, which offer these services. What helps these days is that most of these large centers such as AIMS or Nimhans have open teleconsult services. So even if you don't have a center nearby, you could always consult doctors in one of these places who will guide you to seek help locally.
Right. Absolutely. Sir, I would like to conclude with this and any parting note on the session which you had, if you would like to add.
So, what I'd like to say is this pandemic has certainly not ended. So, continue to take basic precautions such as mask wear, hand hygiene, and try to avoid crowded places as much as possible. And when you come home, have a bath. Basic hand hygiene needs to be followed. Even though the vaccine has come, it is still time. We're not sure whether it's going to be effective or not, and uh, please exercise precautions while maintaining basic health with the measures that I've mentioned.
Absolutely. Thank you so much, Dr. Shrikant, for your time today on a Sunday morning. And we would definitely like to collaborate with you again in the future. Thank you so much. And we would also like to welcome Dr. Kanan. I guess he has joined. Uh, Yes, thank you so
Morning.
much, sir, for joining. I hope you had you joined clearly now. I sent you the link as well. So I would like to welcome Dr. Kanan, consultant endocrinologist. He's the head of the department from Narayana Health City, Bangalore. He's joined us for this session on endocrinology today. And sir would like to present a PPT, and I would again come back with the questions once you are done with your session, sir.
Sure. Thank you. And I thank the entire team for organizing this and helping us, improve the, information spread that happens. Right now we're all on the information overload, and it's good to have people uh, talk about the right things and, the dispel some of the myths around. The PPT or the PowerPoint is just a kind of for the information flow. I'm not planning to present from the PowerPoint. In fact, my talk is just going to be a very simple and a discussion that I would like to ensure. I hope people who are seeing this and are in the broadcast can ask a lot of questions, and I'd be more than happy to answer a lot more questions than me alone talking my views and viewpoints. So I would want this as a more of a dialogue and a discussion rather than a single monologue lecture delivery. So the PowerPoint is just to help the flow of information and to convey some of my thoughts in a sequential way. So clearly what Shrikant concluded by saying that the pandemic is not yet over, and I think it's important that we've all gone through a very difficult time, and it's clearly not the time to lower the guard. I think one has to be very careful. What I would like to talk today is on overall about how the diabetes disorder, and I'm going to stick to the type 2 diabetes part, which is the commoner type, how it has evolved, managing both diagnosis as well as management of this disorder has evolved in the the last 1 year, and we've seen some interesting changes that have happened. So I will give you my personal experiences as well, of course, and I will also give some suggestions to the public who are watching this so that they can also utilize these tips and tools to help themselves out as well. Of course, any specific questions I'll be happy to answer. So next slide. Can I change the slide too, or I don't think I can change it.
Sir, it's totally up to you if you can share, and actually our IT team is also doing it. Deepak
Okay,
is
so I'll
also...
just ask them to change as and when I need it. That should be fine.
Yes, he can do that.
So one question that is a which is always been asked wherever you are as an Indian, whether you are in India or whether you're abroad. We as a population tend to have a higher incidence of diabetes. And again, for people who are not sure, diabetes is basically a disorder where there is a problem with glucose metabolism. The body is not able to handle your glucose effectively. It's in a simple way I tell to remember a kind of a two-wheeler. In a two-wheeler, you have the petrol in the petrol tank, and you have the engine below down. The petrol has to flow from the petrol tank into the engine, and the engine will run the vehicle, and you can go well. You can go fast. If the petrol stays in the petrol tank or in the petrol tube and does not go into the engine will not be able to run. That's how glucose is. Glucose is like the fuel. It's like the petrol. It stays in the tank and it's going to be circulating in your blood all over, but it has to enter into the cell for it to give the cell its vitality or its energy. And this transition of glucose into the cell is regulated by insulin. So if insulin does not work well, or if there is no production of insulin, then there is going to be a problem. The cells will not get enough glucose, so the ability of the cell to metabolize glucose becomes less, and so you have various problems related to that. Because the cells are not getting glucose, the glucose accumulates in the blood more, so the blood glucose levels are higher. Consequently, the urine glucose levels are also higher, and hence there are other complications that ensue because of this, because the glucose levels then get deposited in various vessels into it sort of changes the protein content around the vessel wall, around various organs like the eyes, the kidneys, the nerves, and cause a lot of complications. So basic problem here is the petrol is not going to the engine is not working very well, so the vehicle is not moving as well as it should. And why are Indians so more prone to diabetes? And that's a, if you change your location and go to a different country, you still are higher risk. There's something that is, inherent to us. Next slide. There are four important aspects to this, and I think I will, this is a summary slide. I mean, it's not a comprehensive discussion of all the factors, but I think most of us, when we are born with lesser petrol in our petrol tank, which means we have lesser insulin reserve in our body. Well, that's a fact, and we cannot change that much. As a South Asian population, whether you are in India, Pakistan, Bangladesh, Sri Lanka, wherever you are in the Southeastern Asian quadrant, you are likely to have lesser insulin production to begin with. The second aspect is we are sarcopenic. Sarcopenia means less muscle mass. We as Indians tend to exercise less, tend to have lesser amount of the muscle protein. Muscles are very important to take up the glucose. Now, I told you that the glucose is running in the blood and is not going into the cell. Now, there is one cell that can pick up the glucose without much of help from insulin. I told you that insulin is required for the glucose to go into the cell. And that's how the cells will get vitalized and energized. There's one organ or one tissue in the body which does not require much of this insulin to take up the glucose. That's muscle. Unfortunately, as Indians, we tend to be more sedentary, less muscle mass, more fat mass, and hence, even though we are not as heavy as people like the Western counterparts, we have very less muscle mass compared to them, and hence our uptake of glucose from the blood is also very less. So the blood glucose levels are also quite high, and that again contributes to the increasing, I would call this a diabetic pandemic in India as well. Of course, a fact of denial, and I think there is both a denial from most of us when we first see the sugars and it's high, we say no, it's unlikely to be correct. We will recheck the lab. We will do this. We will do that, forgetting that the process has begun. And if you deny the process has begun, it's difficult to check it, and you will, you fall into the trap of doing things that we think is right, and unfortunately letting it go too far before seeking help. Attitude. I think there is an attitude difference from both patients and healthcare providers. Patients tend to always minimize the impact of sugar. Oh, it's only borderline. It's just a little bit above the normal. It's a little bit higher. It's only pre-diabetes. It's not diabetes yet. I think the sugar levels are being constantly lowered to facilitate pharma companies, and so many reasons people give. Doctors, on the other hand, also play a part in this attitude. Oh, okay, he ate laddu yesterday, that's why the sugars are high today, so I will not do any medicines today. Let's see after 2 months, 3 months. The problem is, if your sugars are high on one visit, the process has begun. And it's important for us to remember that if you are a pre-diabetic, which means a stage before diabetes, if I take 100 people with pre-diabetes, in 5 to 10 years, 90 of them, that is 90% of them, will transition from a pre-diabetic to a diabetic. That means the conversion rate from what we call borderline sugars to actual sugars is close to 90%. And India tops the list because of the above two important factors. So it is important not to underplay the pre-diabetes part. And I think a lot of young, healthy people who otherwise are normal get a masked health checkup in their company, get a checkup as part of the insurance program, find the sugars to be slightly high. They dismiss it. They say, okay, it's only mild elevation. I'm not diabetic yet. It's okay. No, it's not okay, because the process will quickly transform you from a pre-diabetic to a diabetic if appropriate measures are not taken. So I think this is very important to understand. Let's go to the next slide. So early diagnosis is the key. Unfortunately, we don't have the system that the Western countries have in terms of a family physician visit every 6 months or every year once to have your checkups done. The family physician would know about you, would know about your family, would know about the community where you come from. And that would be the ideal setting where the every small town or a district will have a family physician to take care of that community of population. That's how the PHC primary health center concept came into being. But unfortunately, with the urban population, this is not going to work out. And I think what most people do is end up getting blood tests. Now, access to blood tests in India is as easy as it can get compared to other countries. I think in India, if you want to sit in your home and order a blood test, and you can get a blood test, no matter, you don't need a doctor's prescription, and you have labs selling their own packages to people right at the doorstep. So I think one has to take advantage of this scenario. I would say that if you have crossed 20, and I'm going to show you in the next slide what are some of the risk factors that I think are important, then you should have access to testing, and you should have your testings done at least once a year to ensure that your glucose levels are in the normal range. And that's very important. If you don't pick up things, people still keep on to old thoughts. Sir, I had a wound in my leg. I fell down, I got cut in my leg, and it healed in its own. And I think I don't have sugar because it healed very fast. But that healing process will be impaired if you have 10 years of diabetes and your sugars are constantly very high. That's a completely different ball game. You cannot negate the possibility of diabetes just because a wound healed well. I don't wake up in the night for urination, and that's why I don't have diabetes. Well, if you have to wake up in the night for urination, your sugars should be more than 300s. If your sugars are higher but not very high, you may not have any symptoms. And these disorders are basically silent disorders. So unless you check, you will not be able to find it out. So I think most of us should make use of the fact that lab testing has become accessible to all of us. So ensure you get yourself tested. And they are very simple tests. And I'll tell you what tests to do as well for diagnosis. And that's very important. Next slide. There are various risk scores for diabetes. And, I think pretty much everyone who has a family history of diabetes and their BMI, body mass index, is more than 23. Body mass index more than 23. And if there's a family history of diabetes, please get your sugars checked at least once a year. Now, when you check your sugars, the typical testing to be done is usually a fasting sugar. You can either do a postprandial, which is the post-meal, 2 hours after a meal, or you can do a glucose testing 2 hours after a 75-gram glucose load. On a third setting, you can also do a test called HbA1c, which is a 3-month average. Both of these tests are pretty good. Either you do a 75-gram glucose tolerance test, or you can do a HbA1c once a year if you have a BMI that is more than 23 and if there's a family history of diabetes. If you're a woman who have had pregnancy diabetes, please have your sugars checked periodically. You are at a very high risk of developing diabetes in your future. Fatty liver disease, we recognize, is probably the starting point of all metabolic problems. When the fat gets deposited in the liver, insulin is not able to work very effectively. So the liver is able to release more glucose into the bloodstream. So you have higher sugars in the blood. So fatty liver disease is an important disorder. If you have fatty liver diagnosed on ultrasound or in your blood test with a liver test, then it's important to have your sugars checked as well. Women with polycystic ovary disease and irregular menstrual cycles definitely should have their sugars checked annually. Any abrupt weight gain or weight loss should trigger the check for sugars, because that can be an alarming symptom as well. This is not a comprehensive list, obviously, but the point or message to get across is use the access to testing. Most of us, including me, who I'm talking right now, are at higher risk of diabetes. Family, definitely there's a history of diabetes. BMI is definitely more than 23. You have to have your sugars checked at least once a year. That's the only way we'll know when we are getting it. We cannot wait for symptoms to come and then check. It might be too late. Next slide, please. Now, when you are diagnosed with diabetes, how do you handle it? And that's the other part of the question, right? So, okay, so you check your sugars and it says, come back as pre-diabetes or diabetes. How do you go about handling it? And I think the important elements of this is always a multimodal balance. Diabetes is never a single factor disease. In fact, we call that in the medical parlance the octet. There are 8 different factors that control the sugar levels. So there are various problems that sort of come together, and that's why you get diabetes. So when the problem itself has got multiple causes, treatment should also be multi-pronged. It cannot be a single fort with either lifestyle or only medications or only, a particular aspect of therapy. It has to be multimodal. And that's very, very important to understand that. So lifestyle changes, which can involve diet, physical activity, are very important in the beginning. And that's absolutely no denial of that. That plays a tremendous role in the overall management of diabetes. But keep in mind that medications are sometimes required to maintain levels at a reasonably good level, because there are elements in this problem that are beyond the control of lifestyle changes. And that's why I come back to the point when I told why we are more prone, because we are born with a little lesser reserve. When the petrol tank has a lesser petrol, you probably need an additional refueling once a while. And that is helped with medications. This refueling, if you don't do, regardless of lifestyle, you might end up having still higher sugar. So people come and ask, sir, I have been doing all the right things in my life. I've been running. I've been doing my 10Ks every week. And I work out this. I have a personal health coach. I eat well. I count my carbs. I limit my carbs. I have lost weight, but still my sugars are high. And that is precisely because the fuel tank is on a reserve. You need some supplement to keep the sugars under control, to improve your insulin production. The doctor can decide what medicines are best for you. So taking medicines does not mean a personal failure. And I feel that people are guilty about it. I've done all this and I've still failed. That's not a personal failure. That's because diabetes is a complex, heterogeneous disorder. For some people, just one tablet might just work for about 10-15 years. No problem. They're doing really well. They're very lucky. Their reserve is pretty much manageable throughout the next 10-15 years. There are some people who do everything right, still can't get the sugar under control, and they require additional medications. And that's because their ability to make insulin is deteriorating every year. And that's probably not under their own personal control. That's important to keep in mind, that this is a multifaceted disorder. The progression of the sugars may be different for different people. So you see somebody online reporting that I have been doing all this and my sugars are perfectly under control. That's probably because they have a good reserve, and that may not apply to you. You may not have a good reserve, and so copying what somebody else is doing and finding it's not working for you does not mean that the method is wrong. It means that you are different. The third important thing I think is important is to monitor sugars, and I think everybody who has either a pre-diabetes or a diabetes should have access to monitoring sugars at home. You should be able to get a glucometer. There are various brands in the market. You also have something called continuous glucose monitoring. It may be a little overkill for people who are having borderline or milder variation in sugars, but people with higher levels of sugars, monitoring with a continuous glucose monitor is very useful and actually gives you a very good instant feedback on how you are doing day to day. Some people may not like the fact to keep knowing the sugars every few minutes. I personally don't want to know every minute what's happening to my sugars, but I think a glucometer is a valuable tool, and I tell my patients to monitor it at various time points of the day. Some people religiously do it in the fasting and after breakfast. I tell them, what happens after lunch? What happens after dinner? We don't know those values. So you check your sugars on a 1 week. You can do it on the fasting and after breakfast. 1 week you can do it before and after lunch, and 1 week you can do it before and after dinner. So that way you spread the testing out from various time points, so you really know how things are going on at various time points of the day. So these are various modalities by which you can monitor. Again, another mistake people end up doing is they go to a lab. The cheapest test to do is the fasting and the post-meal glucose. They will check that every month, and as long as that looks okay, they're okay. No, you have to get your HbA1c at least every 3 to 4 months once, so that you know that your sugars are well under control. So HbA1c, both for the diagnosis as well as for management, is a very useful tool. So monitoring glucose at home with a glucometer at various time points during the day, checking your sugars with the HbA1c levels every 3 to 4 months once or every 6 months once, depending on your control, will help you better manage or understand your progression better. So that will tell you, okay, I started my last year with a HbA1c of 5.6. Now it's 5.8, and in the year down the line at 6.1. you're progressing. That means your diabetes is getting worse. You'll have to act differently or do something different so that you can slow down the progression. We may not be able to stop the progression completely, but we can at least slow it down. So these things are tools that are available to us, and we should be able to make good use of it. Next slide. Now, I get back to the point that I told. People always find, sir, if I start medicines, it becomes a permanent thing, and I don't want to go on to medicines because it'll become permanent. But then you have to understand that there is a biology behind it, which cannot be changed much. So if there's a biology and you have to respect that biology, that the insulin reserve is less, you may have to need medicines. So taking medicine is not a personal failure. Taking medicine does not mean that you can stop doing your physical activity. You continue with that. At the same time, you also take your medicines because you need to refuel your tank once often so that you maintain the sugar levels at a good control. So depending on your fuel reserve, your body's reserve, you may need medicines or may not need medicines. You may need one medicine or you may need two medicines. You may need three medicines. You may need insulin, depending on your reserve. If your reserve is extremely low, you will need insulin. And that got nothing to do with your failure of lifestyle. It doesn't mean that you failed in your measures of good lifestyle. It just means that the inherent biology of the disease is that way. Now, the other thing that significantly influences diabetes is weight loss. I can't emphasize it more often. We see two very contrasting scenarios where diabetes goes into remission. We see a lot of advertisements on paper and in media. Diabetes is cured. Diabetes is not cured. Diabetes is gone into remission. And when you say remission, you have attained a sugar level that is below the level of the diagnosis of diabetes. And when does that happen? We see two very common scenarios. One scenario is when people undergo gastric bypass surgery. A gastric bypass surgery is usually done for obesity, either morbid obesity or obesity with comorbid conditions. And when they lose a significant portion of their weight, they are able to achieve almost a normal sugar level, completely stopping all their anti-diabetic drugs. So weight loss has a profound impact. Second unfortunate example is when people get cancer. They lose a lot of weight. There's a problem with the cancer cells, so they lose a lot of weight. And once they lose a tremendous amount of weight, they stop the diabetic medicines and the sugars get better. So we find that weight loss is a crucial tool to help you reverse or keep the diabetes in remission. So even if you lose 10% of your body weight, so somebody is 70 kilograms, if you lose 7 kilograms in a span of 1 to 2 years, there's a very good chance you could be reversing or putting your diabetes into remission. So that's an important tool. Again, it's not about dramatic change. Sir, I will lose 7 kilos in 1 month and I'll come back and show you. That's not what we're asking for. Do it over a period of 2 years. No problem. Take your time. Go slow. Consistency is more important than dramatic changes. In fact, the more dramatic you change, the more dramatic you will regain back, because these are dependent on weight set points, dependent on your appetite centers in your brain. So the faster you lose, sometimes the faster you will regain. Whereas if you are consistent and do it over a longer period of time, the chance that you will regain back is actually quite less. Next slide. So what have we seen during this pandemic? Next slide. How has diabetes management become different during this pandemic? Can I have the next slide? We have found increased recognition of diabetes. Why? People are now accessible to the hospitals because of the pandemic. They come to the hospital for COVID testing, they're positive, they're put in the hospital, they get their blood sugars automatically checked. What you were not doing at home is now being done in the hospital. So you find more diabetes. Now, initially, there was a surge in the papers saying that COVID created diabetes. No, COVID just created the scenario where more people got tested. And that's why you found the incidence of diabetes to be more. And that's got nothing to do with COVID. It's purely because you have recognized you're doing more testing. Obviously, people are under stress. There's an infection going on. There's a viral infection going on. You are likely to have higher sugars during the hospitalization. So more severe hyperglycemia was diagnosed during this period. And that is, again, not only common for COVID, it is common for any viral infections will result in a higher sugars. Of course, treatment of COVID, using steroids made sugars worse. People who were just borderline were given steroids and the sugars went up very high, needed medicines, insulin. Similarly, people who were on diabetes on oral drugs, when they came into the hospital, got steroids, sugars went up higher again, and they required insulin again. So what we've noted in the pandemic is we have recognized more people having diabetes, and we have sort of also recognized that people's sugars going out of whack because of the treatments during the hospital. But in majority of patients, things reverse back to normal and they go back to where they were a few months later. A few of them continue to require higher doses of insulin, higher doses of medications, probably because of some amount of impact on their beta cells or the cells that produce insulin. So probably some of the petrol reserve has gone down a little further down after the COVID attack. We don't really know the exact mechanisms how COVID will reduce that reserve. Probably more details will come about this in a year or so later. But I think for now, we notice that a few people are not able or not on the same medicines they were before the COVID. So we found a few people that are requiring higher doses of medicines. One thing that has affected diabetes management is a delayed follow-up. So I am seeing patients now who have seen 1 or 2 years back. They never came to follow up, and again the common excuse they will all give, sir, it was COVID, and hence I could not come. And I find most of them come with very uncontrolled sugars because they have not been monitoring the sugars properly. So that has created a big impact of no follow-up for a long period of time. So I think what the pandemic has really done, it has delayed the diagnosis and treatment of a lot of our metabolic disorders, particularly diabetes, hypertension, cholesterol issues, which are now slowly resurfacing up again. One thing alarming and unfortunate is people neglecting their food ulcers and food problems, because the pandemic, access to hospitals and closure of smaller centers near their homes. This has led to a lot of people coming to us with very advanced food infections, foods requiring operations, amputations, debridement, so on and so forth. So this is a very unfortunate scenario that the food care has already, it's a little low in India. With the pandemic, it has become even worse. People coming to us with advanced leg ulcers. One interesting thing is we've had about close to 100 children with type 1 diabetes, and we have not had any major issues, people with type 1 diabetes getting COVID or having a serious complication. So luckily, children seem to be doing really well. Even those with type 1 diabetes seems to be doing really well. That's what we've learned during this pandemic. Next slide. Now, what have we done at NH, at Narayana Health City, to help patients with diabetes? And I think this is probably my last or penultimate slide. So what is important we have understood in the management of diabetes, and we have been doing this even before the pandemic, is that you have a multimodal aspect of therapy. The treatment does not end in the clinic, and that's very, very important. We realize that diabetes management is not over once the doctor signs the prescription, gives it to you. The treatment actually begins after you go home. So we have a nurse educator who will tag along with you over a phone. So you will be able to send sugar readings and get your medicines regularly adjusted. This remote monitoring has been happening even before the pandemic, but its value is now understood during this pandemic. People are coming from far off, they're not able to travel, the borders are becoming more and more stricter. So they're able to send their sugar readings to various electronic devices to a designated person, and that's very important. Doctors cannot become burdened with a direct inflow of messages to their phone or their email. It's not possible for the doctors to monitor this at a higher scale. So we have dedicated nurse educators who will do this and who will form the bridge connect between the doctor and the patient. Next slide. So comprehensive early testing, that's very important. We get them tested well. A multimodal management, we have a dietitian, exercise therapist, a behavioral therapist, and an endocrinologist who manage the patients with diabetes. And last, as I mentioned before, the remote monitoring aspect. Remote monitoring, glucose monitoring at home by patients gives the patient a little bit of responsibility. And I think that's very important. Patients are part of this game. It's not that doctors will have to manage your diabetes all the time. No, patients have a role to play, and patients understand that they're responsible for their sugars. They monitor, update the physician, and the physician is able to adjust things over a period of time. So by the time next time the patient comes, maybe it is 3 months or 6 months or 1 year, we still are in touch with the patients. We now have ability to do a video conference call with them as well in between, in case they need to talk to the doctor as well. So these services have helped us manage diabetes better during this pandemic time, and hope to continue this even after the pandemic, so that this becomes um, a, a regular aspect of care and improve the diabetes care. So we want to change India from being a diabetes capital of the world to a diabetes care capital of the world. Thank you very much.
Thank you so much, sir, for this beautiful presentation. If you can kindly elaborate on the care of senior citizens during this time of COVID-19, like post-COVID, also post-COVID sequelae. If you can kindly elaborate on that a bit.
As I mentioned before, in the post-COVID scenario, once you had COVID and you're recovering from it, the patients who have had diabetes before generally get back to their usual drugs that they're taking for diabetes. In a small fraction of patients, maybe I would say 5 to 10% of patients, they require a higher dose of medications or a higher grade of medicines, or maybe a different medicine, or sometimes insulin. Now, we don't know why this has happened. This was clearly after they have stopped their steroids, they have stopped, they're not acutely sick, they're not on oxygen, their lungs have recovered, but they still require a different modality of treatment. Whether the viral sequelae has impacted their pancreas is hard to say, because we don't have data to prove that. But there is a certain segment of population who will need a revision of their diabetes schedule. So if you've had COVID and your sugars are not getting better, please consult your doctor so that things can be reversed. In majority of patients, they get back to their pre-COVID medications. Of course, a lot of people are being newly diagnosed because they have been tested in the hospital and they found to have diabetes, and you will have to take adequate precautions and care of the diabetes. Don't think that it is just a transiently high sugar during the COVID. It will continue, and you have to be on medicines, or you have to be on good lifestyle management for that, depending on what your doctor is advising.
Right. So, how frequently one should test on diabetes? How frequently testing should be done on
If
diabetes?
somebody is if somebody is already a diabetic and they are on tablets, I would recommend at least about every 4 to 6 months once they will have their sugars tested. What I recommend for most patients is to have a glucometer at home and
Right.
check at various time points of the day. So if you're well controlled, you can probably check once in 10 days or once in 15 days, or once a month. If you are sort of not so well controlled, suboptimal control, I would say check every week, or every week once. And if you are very poorly controlled, you're on insulin, you probably need a daily or alternate day check. That's a glucometer testing frequency. From a lab testing point of view, if you are very well controlled, 6 months or 1 year once. If you are suboptimally controlled, every 3 to 4 months, and if you're poorly controlled, probably every 2 months once, lab testing is done. So there's lab testing and there's glucometer testing. So both needs to be frequency will need to be adjusted according to the medications that they take, insulin they take, or how poorly or how well their sugars are controlled. If they are not a
Absolutely.
diabetic, if they are not a diabetic and they are normal, I would recommend at least check it once a year.
Right. So, if you would like to add something on your session around summary, if you would like to conclude with that, sir.
So I think what we've learned from this from the COVID pandemic point of view is, I think testing yourself early will help. Monitoring your sugars at home is a valuable tool for you to understand uh, how things change over time. And third important, I feel, is if you're a diabetic patient and you're on follow up with your physician, the remote monitoring of sugars is a very useful tool, to help doctors adjust your treatment as we go along. Sometimes patients come to us with a sugar report after 1 year. It's very hard for me to change things because I don't know what went wrong. Whereas if you constantly give a feedback, it helps us adjust things over a period of time. So that by the time you come at the end of 6 months or 1 year, things are actually much better and we've already made the change what is required. So be in touch with your physician, no matter where you are. There are various digital platforms which enable video consultations and remote monitoring by a lot of physicians across the country. So don't lose your diabetes care because of the pandemic. Do not let diabetes go uncontrolled, citing the COVID excuse, because diabetes can again have its own complications, which is going to become more difficult to manage than COVID.
Right. So, sir, with this, we conclude our today's session on Panacea. And I would like to inform our viewers that we will also be doing sessions on tuberculosis coming on the World Tuberculosis Day is approaching. So, we will be having a lot of sessions on tuberculosis awareness, and there will be a lot of initiatives on it as well, along with COVID-19, which both of the diseases are so important right now to take a note on it. And with this, I would like to thank Panacea, the entire session of it, and sponsored by Viatris, an initiative of eHealth and Ilet's Technomedia. And I would also like to thank Narayana Health for supporting us throughout the months right now. So please log on to panacea.iletsonline.com for further information. On the website, every information is available, and feel free to reach us at this website as well. All our numbers are also given. And thank you so much, sir. I thank all the viewers for watching with us today. Thank you so much for this session today. Thank you.
Thank you.